Torn your meniscus? Think you need surgery? Not so fast. There's a better way, and I'll explain exactly what that looks like. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about a very common knee injury, a torn meniscus. This is something I see all the time in both young athletes and adults dealing with wear and tear arthritis. The first thing most people hear when they're told they've had a meniscus tear is you probably need surgery. But here's the truth. Most meniscus tears do not need surgery. In fact, surgery can often make things worse. Let's dive into what the meniscus is, what happens when it tears, and the best ways to treat it without surgery. What is the meniscus and why does it tear? The meniscus is a piece of cartilage in your knee. You've got two of them in each knee, one on the inner side and one on the outer side. Think of them like soft cushions that help absorb shock between your thigh bone and shin bone. They also help keep your knee stable and moving smoothly. Now, the meniscus can tear in a couple different ways. You can have a traumatic tear. This usually happens in younger people or athletes. You twist your knee suddenly, maybe during sports or a bad step, and boom, it tears. It's like if you bend a credit card too far, it eventually cracks. Then you've got degenerative tears. This is the more common type of tear, especially as we age. It happens slowly over time due to wear and tear and instability. It's like how the tread on your tires wears down over time. So what are some of the symptoms of a torn meniscus? Here's what most people will feel. Pain, especially when twisting or squatting, swelling in the knee, a popping sensation at the time of injury as well, catching, locking, or feeling like the knee is giving away. But here's something really important. Not all meniscus tears cause major pain or problems. A lot of people have small tears that may show up on an MRI and don't even know it, and it's not even actually causing any symptoms in them. So, do you need surgery for a meniscus tear? Here's the key question, and the answer is most of the time, no. Let's break this down. One of the times you don't need a surgery, if your pain is mild to moderate, if your knee is not locking or stuck, if your tear is degenerative, caused by wear and tear, meaning degenerative arthritis, and if you can still walk, bend, and function with the knee comfortably. So when should surgery possibly be considered? If your knee keeps locking and won't straighten. If you have a large traumatic tear and you're younger. And if you've tried conservative treatment for months and still have disabling pain. But even then, first start with non-surgical treatment first. The reason why is because surgery comes with risks, and many people don't actually get better after knee surgery. In fact, surgery often removes part of the meniscus rather than repairing it, which can then accelerate the arthritis process longer term. So what does the research say about this? Several studies over the past decade plus have shown this exact finding, that meniscus surgery, if you have wear and tear arthritis in the knees already, works no better than physical therapy. Here's a general study summary. Patients with degenerative meniscus tears were split into two different groups. One group got surgery, the other just did physical therapy. After 1 year, both groups had similar results, but the surgery group had more complications. So if surgery doesn't give better results and carries more risk, why rush into it? Again, the only time you should be considering surgery are if you have mechanical symptoms, meaning locking or catching symptoms, and if you fail conservative options. If you have wear and tear arthritis in the knee, your issue is chronic instability, and that does not require meniscus surgery. That generally requires more non-surgical treatments, and end stage, if it gets really severe and if you failed everything else, then even knee replacement surgery. But actually just trying to repair the meniscus or cut out the meniscus is generally not appropriate in patients who have a degenerative meniscus tear. So what should you do instead? Here's my step-by-step approach based on how we treat patients here at Chicago Arthritis and Regenerative Medicine. Step one is always understand the root of the problem. Every injury has a root cause. For meniscus tear, that could be inflammation, joint instability, poor movement mechanics, aging cartilage as well. We figure out which one is driving your pain and then decide on treatment based on that. Step 2, start with conservative care, regardless of what the cause is. Before jumping into procedures, we go with the basics. Guided exercise and physical therapy, an anti-inflammatory nutrition approach, weight loss if needed, supplements like turmeric or collagen. This approach on its own can dramatically reduce pain and improve function. Step 3 is then consider advanced non-surgical options. If you still have pain after conservative care, we can go one step further and still without surgery. Here's what we would use. Injections such as prolotherapy. This is a series of injections that help to strengthen loose or weak ligaments. It's great if instability is the problem. Number 2 is platelet-rich plasma, or PRP. We take a sample of your own blood, concentrate the platelets, and inject them into the knee, in particular into the knee joint, the meniscus, and the ligaments. This can help to reduce inflammation and encourage healing. And then lastly, there's bone marrow concentrate stem cells. For more significant cases, we can use cells from your own bone marrow to help heal and optimize the meniscus and the surrounding tissue. All of these treatments are minimally invasive, lower risk, and can delay or prevent surgery. If you pursue a regenerative medicine treatment that I just described above, there's a couple key things that your physician needs to do in order for you to get an optimal result. To begin with, your physician should be a non-surgical musculoskeletal expert. They should know what they're doing here. Number 2, they should be using image guidance. For treating the meniscus, it's generally utilizing ultrasound guidance to make sure that they're hitting the meniscus, then the joint, and then also the ligaments around the knee. And then the last is they need to utilize a prolotherapy approach, where they're treating not just the meniscus and the joint, but all the other soft tissue structures like meniscus and tendons as required to stabilize the knee. If they take that kind of approach, you are more likely to get an optimal or better outcome than if they do not do that. Now let's talk about what you should not do. A couple of treatments you want to avoid unless it's absolutely necessary. Number 1 is cortisone injections. These reduce inflammation fast, can reduce pain short term, but typically only help short term. Long term, if you get too many steroid injections, it can actually damage cartilage and weaken tissue long term, all of which is counter with what you want for your long term knee health. Number 2 is meniscus surgery. That strictly is cutting out tissue. This may relieve pain short term. And again, it can be useful in folks who actually have a large tear and locking symptoms in the knee, but it's better if they actually try to repair the tissue. That typically doesn't happen. So typically when you're just cutting out the meniscus, it can leave the knee more unstable long-term, raising your risk of progressive arthritis long-term as well. There are other types of injection treatments as well. There's radiofrequency ablation. You'll see pain medicine doctors doing this a lot. This is typically burning the nerves to stop the pain. Helps to reduce the pain short-term, but it doesn't fix the root problem and can actually make things worse over time because it can actually leave some of the muscles weaker as well. Here's a real-world example. I had a patient, man in his 40s, generally active, started having knee pain. His MRI showed a meniscus tear. His surgeon recommended surgery right away, but he wasn't ready for that. We started physical therapy and anti-inflammatory nutrition program. He had some early degenerative changes in his knee, as well as a little bit of laxity in his medial collateral ligament. We ended up utilizing PRP treatment, injecting the joint, the medial meniscus that was affected, and the medial collateral ligament. He's 6 months later, he's back to playing tennis, staying physically active, avoiding surgery as well. Some common misperceptions that people may have regarding knee meniscus tears. Number 1 is you'll hear people say their MRI says that they have a tear, so they must need surgery. Again, that's not true. MRIs show tears, but they don't necessarily tell you if that tear is causing your pain or how it's functionally affecting you. Lots of people have tears on their imaging, but they actually feel fine. You need to figure out if that tear is actually causing problems. Your physician needs to be able to properly examine you and figure that out. Another misconception is that surgery will fix the tear completely. Typically not true. Surgery typically is removing part of the meniscus. It's rare that they actually repair it. In most cases, they're actually just cutting it out. Cutting out that tissue may help short term. The problem is that it leaves the knee joint more unstable long term, leading to potentially longer term problems for you. So let's sum it up here, some key takeaways. A torn meniscus in the knee does not automatically mean you need surgery. Always start with low-risk treatments first, like exercise, nutrition, and regenerative medicine injections. Avoid treatments that damage tissue, like steroid injections, or surgery that's strictly removing cartilage or the meniscus. And your treatment plan should be personalized to your specific situation. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for staying pain-free and living healthy. Thank you for watching. Live well, move better, and take control of your health. See you next time.